Anytime you go to the doctor, whether it's for a regular checkup or because you're hurt or sick, it's important to be honest about your lifestyle and habits, especially if you're having surgery. The American Society of Regional Anesthesia and Pain Medicine recently published guidelines recommending doctors ask patients undergoing anesthesia about their cannabis use, how much they use it, how they use it, and how often. In today's Your Healthy Family, I'm explaining why.
Talking with patients before surgery about the types of drugs they use has always been common practice, particularly when it comes to marijuana. And now that cannabis is legal in many parts of our country and marijuana use is more common, those conversations are even more important.
I've always told people that I don't really care what it is that they use. What I care about is taking good care of them.
Dr. Jennifer Coleman is an anesthesiologist in Colorado, where marijuana is legal. She says talking to patients about their marijuana use before surgery is critical because heavy users may need more anesthesia during their procedure to keep them asleep. She also says marijuana users may have a tougher time with pain management after surgery. Dr. Coleman says for many people across the country, there's a stigma around discussing drug use. And some worry there could be legal ramifications if they tell their doctor they use marijuana.
We're not going to turn people in to the cops. That's not our job. Our job is to be the best doctor that we can for that one person at that one time.
She says in the future, there could be guidelines for marijuana use before you have surgery, like cutting back. But for now, she says to be open with your doctor and not change your habits without asking him or her first.
There is not quite enough evidence yet to tell people to stop cold turkey or to taper. And there's some conflicting reports whether it works, whether it needs to be 7 days, whether it needs to be 14 days. So we need more research on that. It'll really depend on the person and on their coexisting conditions.
Now, Dr. Coleman says a good doctor will never shame you for your habits. So again, just be honest. For Your Healthy Family, I'm Lisa Greenberg. And for more health stories, head to fox4now.com/yourhealthyfamily.